How's it going, everybody? Let's take a look at the exam review strips that I posted for your upcoming EKG exam here. I've already went ahead and went through this, and we're just going to go ahead and cover it through here. We'll go nice and quick. We have the answers through here. That way you can verify what you've gotten so far in preparation for your exam tomorrow. So the first one we have here, 6.4, we have a regular rhythm. Let me get some annotations here. And let's get a spotlight. Here we have regular rhythm, so we measured from here to here, QRS all the way across. It was regular. All of our waves are there, step 2. Our intervals are okay, within range, PR interval, QRS interval. All right, we have no drop beats. So we have a rhythm and a rate of 107, meaning we have a rhythm of sinus tachy. Then we also notice we have some ST segment depression right here. So let's actually go back here and we'll do a little drawing. So ST segment depression is here, 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 and here, all the way across. So we have sinus tachycardia with ST segment depression, and we also have inverted T waves. Okay. Let me zoom in a little bit, make it a little bit easier to see, hopefully. All right, the next one we have 6.6. We also have a fairly regular rhythm here. I wrote in the number of small boxes I counted, fairly regular. We have P waves in front of all of those QRSs, okay? And then we have this pause in conduction, which we call a sinus arrest or potentially a sinus block, depending on this next beat that arises following the arrest. So this next beat has the same P wave as these other beats here, okay? And then we also have about 14 to 15 boxes here. 14 boxes, 15 boxes across to finish that off. We have all of our waves minus at our arrest point here. Okay, we ultimately have a sinus tachycardia with a sinus block and an inverted T wave. And inverted T waves. Next one here, we have a regular rhythm. Okay, we have all of our waves. There's no premature beats or anything. We're pretty slow here at 48 beats per minute. So we have sinus brady, and then we also have ST segment elevation. So if you look here at your ST segment behind your QRSs, we're all the way up here. Here's your really tall T wave here. And this is significant, right? So here's the transition from the QRS complex, and then we have a shift this way. That would be the beginning of our ST segment, finally our T wave, giving us ST segment elevation. Same is true here. However, we have a little bit faster of a rhythm. We are regular. Regular all the way across. We have little P waves in there that look notched, but that's okay. And then again, we have ST segment elevation. So here with our rate of 111 beats per minute, we have sinus tachycardia with ST segment elevation. Going pretty quick here, and that's okay because you have your answers there. And if you follow all of your steps, you should get the same answer that I get. Okay. A little bit different here, but we are also a regular rhythm. Use your index card, you'll identify that. Okay. P's, QRS's, and T's, but we notice here that we have a depression in our ST segment as well as an inverted T wave, our upside down T wave for every single beat. Okay. PR interval is okay, QRS interval is okay, rate is 75. We have a normal sinus rhythm with ST depression and inverted T waves. Okay, similar rhythm here, regular as well. All of our P waves are there, all of our PR intervals are within range, our QRS intervals are within range. We have no abnormal beats, no drop beats, okay, no premature, no escape beats. Okay, our rate is 75, so we have normal sinus rhythm with ST segment depression. ST segment depression. And here, this is our T wave right here. That would be our T wave. Okay. Let's keep it going. Next one here, regular rhythm. We started counting from here to here, and all the way across that became regular. Our PR interval is very close, but it is actually within range. Okay, and all of them are the same. So our PR interval is okay. Our QRS interval, all we can count for is from here to here. So we call that within range as well. No early beats, no late beats, no drop beats. Rate of 79 means we have normal sinus rhythm with ST segment elevation. Okay, big ol' ST segment right there. Okay. We'll keep the heart attack train going here. We got another regular rhythm in 6.84. You have all of your waves. You have a P, a QRS, and a really tall T up here. P, QRS, T, P, QRS, T, P, QRS, T, all the way across. Okay, you also actually have a Q wave. A Q wave is our first time that we see it in a single strip here. But again, the way we identify that, it has to be at least 1/3 of the total amplitude of the QRS complex. So here we have a rhythm of normal sinus, 79 beats per minute, with ST elevation and a significant Q wave. In 8.9, we have a regular rhythm as well. However, we have no P waves, no P waves. We have a QRS interval less than 0.12 seconds, no PR interval because we have no P waves. We have 47 beats per minute. We call this a junctional escape rhythm with ST segment depression. As long as you can see here, our ST segment is down here, right? And our isoelectric line is all the way up here. Okay. So junctional rhythm, junctional escape rhythm with ST segment depression, 47 beats per minute. Okay. 8.13, another normal rhythm. However, you see that we have, after our QRS, we have an elevated T wave, and then we have a P wave. And then a really long pause, QRS-T, P, long pause, QRS-T, P, long pause, QRS-T, all the way across. That is our first degree AV block. And if you remember, our PR interval should be less than, oops, sorry, wrong way. Less than 2 seconds. My pen's dying, so I'm trying to draw with my mouse here, so it's a little bit more difficult. 0.2 seconds. Okay, so we have normal sinus rhythm with a first degree AV block and ST segment elevation. Okay, move on here. This one here in 8.27, we have a regular rhythm, regularity all the way across. Use your index card. Then when you're checking for your waves, you notice that you have an inverted P wave in every single one of these beats, meaning it's coming from the junction. It's coming from the junction. We have a QRS and an elevated ST segment, elevated ST segment. Our rate here is actually 65, and whenever we have a rate that's greater than the inherent rate of what cell that should be firing should be, so typically junctional cells will fire between 40 to 60. This is 65. So we deem it and term it accelerated because it's faster than what it should be. Accelerated junctional escape rhythm with ST segment elevation. Okay. 8.92, we have an irregular rhythm or irregular. We're missing 5 QRSs. We have 5 drop beats. We have a consistent PR interval minus your drop beats, obviously, because you can't calculate a PR interval if you have a drop beat. And this is consistent with a second-degree Mobitz AV block. And we also have ST segment depression and inverted T waves. Inverted T wave is right here, and right here. And because the entire thing is irregular, I use the 6-second method, and I got 30 beats per minute. 9.18, we have sinus tachycardia with ST segment elevation, 115 beats per minute. And I drew some dots here because I was trying to verify to make sure I did not have a first-degree AV block. And here we do not. Slide on down, 9.26. 9.26. We're regular, checking for regularity all the way across. Okay, and then we come across this abnormal beat, which we'll skip for now. We'll continue to check for regularity. You find out that it is regular. You check for your waves. You have P, QRS, and a large ST segment. P, QRS, ST elevated. P, QRS, ST elevation. P, QRS, T with ST elevation all the way across. Okay, so then you want to check your intervals. And you look at your PR interval, and you identify that your PR interval is actually greater than 5 boxes, meaning we have a first-degree AV block. Okay. Your QRS interval is actually within range, so that's okay. QRS interval is okay. It looks like it's just 2 boxes or so. Okay, and then you want to go to step 4 and find your abnormal beats. You found out that this is a premature beat, and it's wide, meaning it's coming from the ventricles. So we have 1 PVC, and so far we also have a first-degree AV block. Okay, and finally, we've already identified that we have ST elevation. You calculate your rate in step 5. You find out that your rate is 100 beats per minute. So you have normal sinus rhythm with a first-degree AV block, 1 PVC, and ST elevation. This one will sweep by really quick. This is 214 beats per minute, and this is ventricular tachycardia. 9.49 is regular. Our rate is 75. We have all of our waves, PR intervals okay, wide QRS, no drop beats. So we have normal sinus rhythm with a bundle branch block and ST segment depression. 9.82, we have a regular rhythm. Okay. We have a wide QRS in each one of those QRS complexes. All right, step 2 is checking your intervals. Your QRS interval is wide, meaning we have a bundle branch block. And then your ST segment elevation is above our isoelectric line. So we have normal sinus rhythm, 71 beats per minute with ST elevation and a bundle branch block. And now let's look at some of our 12-lead EKGs. Zoom out a little bit, that way we can see the whole thing, hopefully. So this is the technique I would recommend using on your exam. Okay, we have lead 2 all the way down here. Here's our 12 leads right here. Okay, you're still going to check for regularity for step 1. And when you're checking for regularity on this one, you're going to identify that it is irregular. So you take that in consideration, and you go to step 2. Do you check your waves? You can check them in any one of these. Wherever you can see a clear P wave, that's where you want to look. You want to make sure all of those P waves look the same. So on the bottom here in lead 2, we can actually identify our P waves pretty well. So we have a P wave right there, right there, right there, right there, right there, right there, right there. And as you notice where I wrote how many small boxes we have, that's the irregularity portion of this rhythm. However, the P waves all have the same shape, meaning they're coming from the sinus node. So the only rhythm that we have that we know of that has regular looking P waves, meaning they're the same shape, but an irregular QRS to QRS is sinus arrhythmia. We'll get to that in just a sec. So you check your QRS complexes. All your QRSs are there, all your Ts are there. You check your PR intervals. Check your PR intervals and any one of the rhythm strips where you can see a real clear P wave. That's okay. And then you check your QRS intervals, and you're going to check QRS intervals in V1 and V2 to identify for a right bundle branch block, and V5 and V6 to identify for a left bundle branch block. And I don't see either of those. So I'm okay there. Step 4, check for abnormal beats. No abnormal beats here. Step 5 is to calculate the rate. Our rate is 80 beats per minute. So we have sinus arrhythmia, okay, 80 beats per minute, which I use the 6-second method, okay. And now we must look into the rest of our interpretation. Check for your ST elevation, which I have ST elevation in lead 2, 3, and AVF. And those are our inferior leads. So we have an inferior infarct here, an inferior infarct. So the likely culprit is going to be the terminal branches of the right coronary artery, the RCA, or the terminal branches of the left anterior descending artery. Okay, that's not it though. We still have SC segment depression in AVL, as well as in V1, right down here. And no Q waves, but we have an inverted T wave in V1. Okay, and then you would write that all out, something like sinus arrhythmia, 80 beats per minute, ST elevation, and then just list them like we have here. Okay, so down here in the next strips, I will write it out the way it should come out onto your exam here. So strip number 2, you don't have a full strip going all the way across, but that's okay. You can still measure from QRS to QRS to QRS to QRS to QRS to QRS to QRS with your index card. Here, ultimately, we have normal sinus rhythm, 75 beats per minute, ST elevation in 2, 3 AVF, V4, V5, V6, ST depression in V1, V2, V3, and AVL. Okay. So lead 2, 3, AVF are your inferior leads. Okay, they give you the picture of the bottom portion of the heart. Okay. So again, the arteries that are affected here are the terminal branches of your right coronary and left anterior descending. All right. I'll show you this one here. Normal sinus rhythm, 83 beats per minute, ST elevation in V1, V2, V3. Okay, here V1, V2, V3. ST depression in 2, 3, and AVF. Okay, so now if we think of the anatomy of the heart, and when we branch off the aorta, we have the left main artery. And then again, that bifurcates or splits between the left circumflex and the left anterior descending artery. Now, the left anterior ascending artery comes over the very front portion of the left ventricle. And in V1, V2, and V3, V4, those are all considered our anterior views. So it makes sense that if we're having a heart attack here, or ST elevation in V1 through V3, we're having a heart attack right on the front of the heart. So the artery that's attacked here, or that's the culprit, would be the left anterior descending artery. And if the left anterior descending artery is having a heart attack, that means there's a blockage, meaning blood is not able to travel past that artery to the lower portions of the heart. Okay, so if the lower portions are not getting any blood flow, that means we're going to see some changes in the EKG in your inferior leads. So 2, 3, AVF all have ST segment depression. Okay, and that's because we are ischemic due to the blockage that we have in the LAD. And then finally, your last one here, we have normal sinus rhythm, 75 beats per minute, ST elevation in V1 through 4. Again, we have an anterior infarct. LAD is your culprit artery, and we have ST segment depression in V6 and lead 1. Inverted T waves in AVL. Okay. All right, guys, I'll see you guys soon. You'll have an exam. I hope you're ready. Email me if you have any questions. Okay, bye-bye.